Welcome to our family programming at the Ridge. I am Dr. Soto. I'm the medical director here. And let me make sure. Okay. Today we're going to talk about medical and psychiatric conditions that commonly occur with substance use disorders. What we talk about this afternoon is by no means exhaustive, and there'll probably be a lot of things that you can think of that aren't included in this lecture, but this is just to give everybody an idea of things that we commonly see in people with substance use disorders. So please remember the importance of confidentiality here. Sometimes you may hear or see things that relate to other people that are private, and if you do, for some reason, please remember to keep those things to yourself so that everybody can feel that they can be open and honest while they're here getting treatment. So first, we'll talk about what a co-occurring disorder is. And you may hear people with medical backgrounds refer to it as a comorbid condition, but they basically can be used interchangeably. And they are used when two or more conditions are present and active in the same person at the same time. It also insinuates that those two conditions also can have an effect on each other. So when one of the conditions a person has is untreated, it can potentially affect all of the other conditions that a person has. And that is particularly true with substance use disorders. So substance use disorders very often occur along with mental health disorders and along with solid organ conditions in the rest of the body. For example, alcohol can cause problems with the bone marrow, with the heart, with the brain, the liver, the kidneys. Almost every system in your body is affected by alcohol intake. And we'll talk about that with different substances that are commonly used as well. So we'll start with talking about mental health disorders. There's a very strong correlation between substance use disorders and mental health disorders. And this is data from the CDC and SAMHSA. 9.2 million adults in the United States at any given time have both an active substance use disorder and a mental illness that have been active and causing problems at the same time in the past year. Only about 10% of people will receive treatment for both their mental health disorder and their substance use disorder. So you think about medicine in the United States is very advanced, but we do a terrible job of treating substance use disorders and mental health disorders. And the vast majority of people in our country do not have access, whether it's because of lack of insurance, whether it's because of where they live, there's nowhere close by. So only 10% of people will receive treatment for both mental health and substance use disorder, and 50% of people diagnosed with mental illness or substance use disorder get no treatment at all for anything, whether it's because they don't seek out treatment or they're not willing to get treatment or they can't access it. Up to 50% of people with a substance use disorder also have a mental illness, and sometimes it's hard to tell what comes first, and we'll talk about that a little bit. In people with mental illness, about a quarter of them have a substance use disorder, so it's not exactly equal when you go back and forth. This is a particularly big problem in adolescents and young adults up until the age of 25. They have the highest rates of substance use disorders. And we do know that adolescents with a mental health disorder are about twice as likely to use illicit drugs. And that's not including alcohol, but adolescents with major depression are at very high risk for using street drugs or prescription drugs that aren't prescribed to them. We can talk about this a little bit. With depression, people are 2 to 3 times more likely to develop an alcohol and drug use problem. Anxiety, disorders are related strongly with alcohol and benzodiazepine misuse or abuse. People with bipolar disorder, almost, well, 2/3 of them have a history of substance use disorder at some time in their life. About half of all people, a half or more of all people with PTSD also have a substance use disorder, and about the same for schizophrenia. So having a mental illness puts people at very high risk for a substance use disorder. Like I said before, we know that there are common risk factors for both a mental illness and a substance use disorder. So when we meet a person coming in, most of the time, by the time they're coming into treatment, they've got a pretty long psychiatric history and substance abuse history, or at least it's been several years where they've been struggling with one or the other. And most of the time we see people that continue to be sick despite treatments because whatever treatments they've received in the past focus specifically on their mental health or focus specifically on the substance use disorder, but didn't really focus on them both together and treat them both together. One of the jobs that we have is to try to determine whether or not the mental health symptoms that we're seeing in a person is directly related to the substance use or if it's its own condition separately. And so a lot of times people will go into treatment somewhere and come out with different diagnoses. I don't know if any of you have noticed, or maybe people with mental health disorders, they can get multiple different diagnoses over the course of time. And at one moment they're bipolar, and the next place they go, they have borderline personality disorder, and the next place they go, it's actually depression and not bipolar. And it's because different symptoms manifest at different times, and if a person is using substances, you cannot diagnose any mental health disorders because we just can't tell what the effects the substance is having on that person's mental health. We talk about common risk factors. These are risk factors for both mental health and substance use disorders. One of them is the propensity for self-medication. A lot of times people with mental health disorders don't know what's going on with them. They don't know how to treat their feelings or their moods or their thoughts, and using substances helps them get a little bit of escape from that, at least temporarily. We know that substance use disorders and mental illness both affect the same areas of the brain, and those areas that are related to stress responses and reward centers and impulse control. And they're also the same neurotransmitters. Systems are involved in both, in particular dopamine and norepinephrine, serotonin as well. There are also environmental influences, and the biggest, like the big three when we talk about environmental influences, are adverse childhood experiences, trauma and chronic stress in childhood, and a family environment. Trauma and chronic stress, we know that early in life, chronic stress or prolonged stress leads to changes in our stress responses, and it leads to changes in the structure of the brain and in the function of the brain. Those changes can lead to impairments in learning, memory, adapting to new situations, or resiliency, sometimes it's called. We also know that it can relate to decreases in impulse control and the ability to regulate emotions. And that's something that people struggle with a lot when they come here, especially with previous mental health issues. There was a study done in 1995 that we'll talk about a little bit, and that's called the Adverse Childhood Experiences Study. It began in 1995. It included 17,000 plus participants, and it basically was, they brought in all of these people and they had them fill out surveys, and they asked them questions about things that had happened in their childhood. And they focused on three areas. There was abuse, neglect, and I can't remember the other one. We'll get to it. But abuse, they looked at emotional abuse, physical abuse, and sexual abuse. Neglect, they talked about emotional and physical neglect. And then household dysfunction. So household dysfunction carried a lot of different things. So if there was interpartner violence in the home between the parents, if there was a substance user or abuser in the home, if there was mental illness in the home, they asked about divorce, they asked about if any family members had been incarcerated in the household. There were actually, these are sort of the big areas, but there were actually hundreds of questions that they could go through. And then they followed these people through, they're still following these people through over years and years and years. And what they looked for were the development of things like mental illness or the development of substance use disorders. They looked at things like, excuse me, did this person graduate from high school? Does this person have a steady job? Does this person now, do they have steady relationships in their lives? And they looked at all kinds of things to try to see how any of these negative experience in childhood affected people in adulthood. And it seems like it's very intuitive. It seems like, well, of course that would affect somebody, but we didn't really know how it affected people, if it really did affect people, because some people are in those situations and their life turns out to be fine, and some people don't. And so what they wanted to do when doing this study was to sort of underline that, be able to say one way or another, are people more likely to have these problems in adulthood if they've had trauma in their childhood? The probabilities, this picture isn't really easy to read, but basically it divided people into 0 adverse childhood experiences, whether they had 1 to 3 childhood experiences, or 4 or more. And it looked, where we saw the biggest difference was 4 or more adverse childhood experiences changed things dramatically. And if you take a look, you can see that if you had no adverse childhood experiences, you had about a 1 in 480 chance of using intravenous drugs. If you have 4, you have about a 1 in 30 chance of using intravenous drugs. With no adverse experiences, people had about a 1 in 100 chance of ever attempting suicide. It's 1 in 5 with 4 or more adverse childhood experiences. This is very definitive information. And the way this sort of correlates is adverse childhood experiences of 4 or more lead to about a 5 times increase in alcoholism compared to the general population, a 10 times increase of using injection drugs, and then a 12 times increase of ever attempting suicide. So these are very dramatic increases and directly related to the number of traumatic events or traumatic situations in childhood. So this kind of just shows people how important it is to look back and uncover any past trauma if it's there. And again, it doesn't mean that somebody that doesn't have past trauma will never develop a substance use disorder or never develop a mental illness, but it just kind of gives you an idea of how powerful these situations are in childhood and how it can affect people later in life. So when we make a diagnosis of a mental illness, when somebody is in treatment for substance use disorders, we have to be very careful. There are overlapping symptoms when someone is intoxicated or in withdrawal versus mental health symptoms. We try to pay particular attention to when in life the mental illness symptoms started, and if there was a person that had they started using drugs yet or not. I've seen people come in with profound mental health disorders that have resulted in hospitalizations and loss of jobs and loss of relationships, and they were never seen by a psychiatrist and diagnosed with anything when they weren't using drugs. And so we have absolutely no idea whether that person actually has a mental illness or whether these are the results of substance use. So we have to communicate. We have to make sure that the psychiatrists are able to sometimes talk to family members or talk to friends or people in that person's social circle, speak with other doctors that have treated the patient. And we do that so that we can get a better history of when symptoms when they first became evident and its relationship to drug or alcohol abuse. Normally, we can't even make a diagnosis of any mental health disorder while a person is using a substance, or usually within the first 30 days after they've last used a substance. Some people wait longer, and there are some issues, especially with stimulants and psychedelics, that may take longer than 30 days to resolve. But in general, we don't make definitive diagnoses of mental health disorders in somebody who is using or has recently been using drugs or alcohol. The other thing that is important to note is that people that have a substance use disorder and a mental illness typically have far worse outcomes than people with just a mental illness or just a substance use disorder. And for a person to go somewhere, and we see this a lot, there are a lot of people that don't accept their substance use disorder, and they'll come in and they'll say, you're asking all these questions about, my alcohol use or my drug use, but really the only reason I do any of that is because of my depression or because of my anxiety. So once I get my mental health treated, I'm not going to need to be here, or drugs or alcohol are not going to be a problem for me. That is not the case. That is not true. And some people will hold on to that so strongly they'll actually refuse treatment for their substance use because they feel like it's just a result of their mental illness, and that's all they want to focus on. We know that people that do that tend to have very poor outcomes, and they tend to continue using substances, or if they are able to stop, it doesn't last very long. So keep in mind, both of these need to be treated in order for somebody to successfully be able to manage their mental illness and put their substance use disorders in remission. Okay. And a lot of this is what we talked about. Treatment for mental illnesses is similar to treatment for a co-occurring mental illness and substance use disorder is very similar to treating any other medical conditions the same. We try to work with family and friends to get support so that they can be compliant with their treatment, just like we do in somebody with a new diagnosis of diabetes or heart disease. We'll involve the family and talk about what their diet should look like, educating about diabetes, and we try to educate the family as a whole so they can support each other. We do the same thing with mental illness and substance use. It makes it very difficult for a person to heal from a substance use disorder when maybe their partner doesn't want them to go to meetings, or if their partner gives them a hard time every time they have to go to group or something like that. People tend to stop going as opposed to insisting that they need to go. So that's why it's so important. We want family members to know this isn't just something somebody is doing to get out of the house. This is treatment, and it needs to continue. And it's important. It's just as important as medication somebody may take. We use medication-assisted treatment with substance use disorders, or we offer it at least, so it is available for people, including buprenorphine for opiate use disorders, naltrexone for opiate use, stimulant use, and alcohol use. And we know that those tend to overall improve treatment outcomes. That doesn't mean that somebody can't get better without medication-assisted treatment, but it can be very helpful for some people. We try to choose psychiatric medications that have a low level of side effects, or at least the least we can, so that people will be more compliant with their medication. We use evidence-based therapies, things that we know work and have been shown to work. And then we strongly encourage sober support networks, because doing all of this takes a lot of time. It's very easy when all of our patients here finish treatment and go back to their life. It is very easy to sort of get swallowed up into your life again and feel like you can just sort of put this all behind you. I'm healed now, I'm better, I don't have time for all that, I have to work, I have to take care of the kids. And that can tend to be a recipe for disaster for a lot of people. So continuing treatment after acute treatment, like your residential treatment, is important for both mental illness and substance use. We always recommend step-down treatment or continuing outpatient treatment after residential. There are some people that don't feel they need it. I'm great, I'm healed, I don't need to do any of that. But in general, people do better the longer they're involved in some sort of treatment, whether it's IOP, whether it's aftercare, whether it's seeing a counselor, any of those things. It's not that people only do better if they're doing IOP. Any type of formal treatment is superior to no treatment at all for substance use disorders. And those include, yes?
I know these have like different weights to them, like obviously partial hospitalization you can put like 3 points towards, but is there like a recommended number of these or like a combination?
Duration, you mean?
But even like combination of someone doing counseling and a 12-step program and sober living, like is there, you know, an optimal number of these or?
Not that I'm aware of, not that I'm aware of. And usually the studies are done and they're comparing. That's an interesting question, because a lot of times when they do studies like this, they compare something to nothing. Yeah. So they might include, you know, they might be, we're studying people that participate in at least 2 months of IOP versus nothing. And so that, while that may be good in identifying that IOP is helpful, it doesn't help us compare between the different levels. So, but I'm gonna look and see if there's anything like that, because that's an interesting question, and I don't know what the answer to it is. Okay, so like she said, partial hospitalization, that's 5 days a week, and going home in the evening. IOP is 3 times a week. Aftercare, at least at our program, is once a week. We also, in some patients, recommend a counselor or a psychiatric provider if the need is there. We recommend sober support and 12-step meetings, or I shouldn't say 12-step meetings. 12-step meetings are the type of meetings that have actually been studied, but there are other kinds of meetings that are not based on a 12-step model, and people find those helpful as well. So whatever type of program or sober support that is helpful to somebody, I feel is effective. I just put 12 steps because that's what's been studied. And then sober living in people that may not have a stable living environment or may live with people that aren't willing to stop using drugs or alcohol or something like that. But we always ask about this, and we always encourage people to participate in step-down treatment. It doesn't matter where you go. You know, you don't have to participate here, but participating somewhere is beneficial for people with these disorders. So overall, I just want you guys to be able to take away from this part that mental illnesses are very prevalent with substance use disorders, that in order to have the highest chance of success in treating these, they should be treated together as much as possible, and people should try to participate in ongoing care. And I want to stress the development of a sober support network as well. Having other people going through what you've been through, there's nothing like it. And a lot of times people with substance use disorders come in and they feel alone, and they feel like there's nobody that understands them and what they're going through and how they're feeling, and they can walk into a meeting and everybody in that room will understand exactly how you're feeling. And that's very powerful when you're trying to heal from something like this. So I encourage you all to try to find a sober support network that is helpful for you, whatever that network is. Next, we'll talk about physical illnesses and substance use disorders. So obviously, people with substance use disorder have an increased disease burden of physical illness. And that's, and that comes about from a lot of different ways. One is that people with substance use disorders typically do neglect their health. They don't normally go to their appointments or take their medications as prescribed and make sure to get their refills, and they don't follow the diet their doctor recommended or their treatment recommendations. So we see that a lot because there are other things on a person's mind when they're using substances. Depending on the drug or that a person is using, that has a direct effect on the body and can cause or worsen conditions that are already present in a person. And along with not going to the doctor, people with substance use disorders typically have decreased access to care. So there are a lot of people with substance use disorders that cannot maintain a job, so they can't maintain insurance, or they can't afford to go to the doctor, and so they don't. Another thing to point out before we start talking about this is polysubstances. So years and years ago, people used to come in and they would have they had alcoholism or an alcohol use disorder, and then went through a period of time where people were using cocaine and they had cocaine use disorders. But the way it has been now for probably the past 15 or 20 years, if not longer, is people are usually abusing multiple substances. It's not, I wouldn't say it's rare, but most of the time when people come in, they're coming in for their alcohol use, but they also use marijuana. Or they also occasionally will use cocaine when they're out with their friends. Or maybe they use benzodiazepines for their anxiety and take it a little bit more than they should and really rely on those medications. So most of the time we're looking at people with polysubstance abuse. And so we have to not only take that into account during the withdrawal period, but also take that into account physically when we are looking for or treating medical conditions in people with a substance use disorder. We'll start with opioids. Opioids create a very complex problem because while opioids are effective for acute pain, they lead to a dependence in about 10% of patients. The rates of overdose deaths for prescription medications alone has actually been decreasing. It rose very quickly in 2013, 14, 15, and back then doctors were being told, you should be giving opioids to people if they have pain, you have the ability to treat it, give it to them. So they started prescribing it, and people started getting dependent on it, and then sort of the thinking changed a few years after OxyContin came out, and then they were told, stop prescribing all these opioids, it's killing people, and you're creating addicts, and so doctors just quit prescribing opioids. And what happened was there were a bunch of people that were dependent on opioids and started using street drugs to treat their withdrawal. Overdose deaths started increasing very rapidly. Up until around 2022, I think we had 2022 or 23, we had the highest rate of overdose deaths ever, and it was around 118,000, I think was the maximum. 2022 was 109 deaths. They have been decreasing steadily year over year since 2023. So there have been marked reductions in overdose deaths in the last 2 years, which is a really good thing to see. When COVID came out, it really pushed up a lot of those deaths and pushed up substance use in general, but we're starting to see a reduction now, and that's great. Aside from dependence and overdose, opioids can lead to a host of medical complications, including constipation, hyperalgesia, liver issues, or similar to what alcohol causes. Sleep apnea can lead to endocrine dysfunction. People that are on opioids have a harder time getting pregnant. A lot of times their thyroid is affected by opioids. Increasing rates of depression, anxiety, insomnia, falls and injuries at home. So opioids in and of themselves, and that's prescription opioids, can cause a lot of medical conditions, some that can be reversible and some that are not. We also see a very high risk of infectious disease transmission when people use needles, when they're using opioids. If they're using something like heroin or fentanyl and they're using it intravenously, we see increased risk of HIV, hepatitis C, high risk of sexually transmitted disease, syphilis, gonorrhea, chlamydia. We see that it's something we routinely treat for because the incidence of people abusing opioids with a sexually transmitted disease is so high. And then infectious reasons. So injecting something into your veins leaves you with a high risk of causing yourself an infection. And it can lead to infections in the heart. So in this slide, this is a sort of a partial cross-section of a heart, and the little green spots you see are bacteria, somebody that injected drugs into their bloodstream and injected bacteria in with it. And this can lead to congestive heart failure. It can lead to damage to the valves down here, and when that happens, valve replacements can become necessary. People can die from this. This can lead to strokes in the brain or bacterial emboli in the brain. And so injecting opioids is extremely dangerous. The next picture is somebody who, the top right, is somebody who developed a compartment syndrome. They passed out. Their friends thought they had overdosed. They all ran away so they wouldn't get in trouble. And the person laid there for about 26 hours before somebody found them. And they were laying on part of their arm, and the circulation got cut off. And when that happens, it starts to lead to tissue death and swelling and increased pressure in the arm. And the only way to treat that is to cut it open and relieve that pressure. And this is a very painful procedure, and it happens with people using alcohol and opioids. And then the last one is just a picture of track marks in the development of a small abscess on the arm. So we see a lot of medical complications with intravenous drug use. And it's very dangerous. So that's something to keep in mind when we evaluate patients like this. So cannabis is always controversial. It's become legal in different states, and most people feel that it is safe, and that there is, there's no reason that they shouldn't use it. There are a lot of ongoing studies right now, but the things that we have shown that can have a negative effect with cannabis use, and it's especially in people that use heavily and start using in their teen years. So a person who starts using cannabis in their teens is far more likely to have these problems than people that maybe use lightly or used in adulthood. And that's probably because the brain is still developing in the teen years. But they have shown about an 8-point decrease in IQ in people that start using marijuana heavily in their teens. There's been shown to be cognitive impairment and memory loss. Problems with memory formation and learning tend to be decreased in chronic cannabis use. We know there's an increase in workplace accidents and injuries. And like I said, these effects are typically seen in people that use on a daily basis and use multiple times a day, as opposed to people that use occasionally. But cannabis use does have an effect on people, and it's important to keep note of that if anyone chooses to use cannabis. Tobacco. We know that it is the leading cause of preventable death and disability in the United States. We know that smoking contributes to multiple different types of cancers, but it also contributes to eye disease. It contributes to diabetes. It contributes to vascular problems, vascular insufficiency, cancers of places other than the lung. So increased risk of colon cancer in people that smoke, increased risk of liver and renal cancers in people who smoke. And we know that about 85 to 90% of people that come in for treatment for a substance use disorder also smoke cigarettes. So we try to offer everybody the opportunity, if they want to try quit smoking, we can help with medications here. And some people say, no, only one thing at a time, but it's actually much better to do it while you're here and while you have support than to wait and try to do it later. These are some images of people with illness related to their smoking. So in the top left is something called Berger's disease, and this is rare, but I actually saw it in my residency, and it's when people that smoke, it causes constriction of the blood vessels in the tips of the fingers, and it's extremely painful. And the only treatment for this is to quit smoking. If you keep smoking, you keep having it. And sometimes it can get so severe that people develop gangrene and need amputation. But I just thought that was something interesting. It's not something seen often, but it is something that is seen, and that's the treatment, quit smoking. This is somebody with emphysema, obviously on oxygen, who is still smoking. And then the bottom right are a pair of healthy cadaveric lungs and then a pair of lungs in somebody who smoked. So you can definitely see the difference there with cigarette smoking. So there's not really a whole lot of benefit to smoking cigarettes, and all it does is sort of decrease your overall health. So anybody interested in smoking, make sure to reach out to your doctor, whether you do it here or somewhere else, and give it a shot. Alcohol. Alcohol is the most dangerous drug used in the United States. It leads to more deaths per year in the United States than all of these other drugs combined that we've talked about today. More than 140,000 people a year die from excessive alcohol use. And that number has not been decreasing. It's only been increasing since COVID. The World Health Organization attributes alcohol to over 200 different diseases, conditions, and cancers. And that includes things like being killed by a drunk driver or injuries sustained while somebody is intoxicated, so like falling down the stairs when they're drunk. It is directly toxic to the bone marrow, the brain, the heart, the liver. So alcohol impacts every aspect of your body. And a lot of times we think of the liver. People will say, oh gosh, I'm just worried about my liver when they're drinking too much. But the liver is only one of the many things that we see in people with excessive alcohol intake. Among people ages 15 to 50, roughly, it is the leading risk factor for premature death and disability. And I think there are a lot of people that don't know that. A lot of time is spent with children in elementary schools talking about not using drugs. Not as much time is spent using alcohol, because in our society, alcohol is legal, it's socially acceptable, and other drugs are bad, bad, bad. But if you drink, nobody really thinks anything of it. But alcohol use is just as dangerous as these other drugs that people use. I think we just aren't sent that message enough in our country because it's socially acceptable to drink here. We talked about the organs impacted by alcohol here. And when we get blood work on people, we don't just look at the liver enzymes. Everybody wants to know what their liver enzymes are. Well, we look at their red blood cells because the bone marrow is affected and they're abnormal, people that drink heavily. We look at their renal function. All of these things can be affected. And the pancreas is one, is another thing that we commonly see. So it's important to know that alcohol affects all systems in the body. It is related to causally related to at least 7 different cancers that we know can be caused by drinking alcohol in the mouth, throat, esophagus, liver, breast cancer. You have a higher risk of breast cancer with alcohol intake, and the larynx. So mostly the upper airway structures, the liver. This is a picture of a healthy liver versus a cirrhotic liver here. And the next picture is the yellow that you see underneath the healthy liver is the pancreas. And the pancreas is very sensitive to alcohol, and alcohol can cause inflammation, which then leads the patient to have severe pain in the upper abdomen, nausea, vomiting, inability to eat. A lot of times they have to be admitted to the hospital for several days for that pain to go away, but then they continue drinking, so it starts happening over and over again. Eventually, it can get to the point where you develop diabetes because of the damage to the pancreas, or it can result in having abscess formation in the pancreas and having to remove it altogether. So the pancreas is another area of the body that's very strongly affected by alcohol intake. In this patient, these images are from an EGD, or a camera view down somebody's throat. And on the left is a normal esophagus. And on the right is somebody who has cirrhosis. And all those lumps are like big varicose veins in the esophagus. And somebody can bleed to death in minutes if these rupture. And so we have to be very, very careful. And these are caused by that stiffness and scarring in the liver, leading to increased pressure in the GI tract and in those blood vessels. So once these develop, they usually develop later on in the course of cirrhosis of this disease, and it can lead to people to die very quickly if they rupture and start bleeding. In addition, we have jaundice, somebody with liver damage related to alcohol. On the bottom left shows a normal heart versus a very big heart, and that's alcoholic cardiomyopathy. That is not something that just goes away and frequently results in the need for heart transplant, and that's directly related to alcohol as well. And then you can see these brain scans, a normal 43-year-old person and then a 43-year-old person with an alcohol use disorder, and you can see the changes in the volume and structure of the brain, and that's due to alcohol use alone. In addition, alcohol is involved in almost 70% of all instances of domestic violence, assaults, and arrests usually related to those assaults. So alcohol causes a lot of socioeconomic problems and violent behavior as well. We can talk about stimulants. So when we talk about stimulants, we're talking primarily about cocaine, methamphetamines, less so about prescription stimulants like Adderall. People abuse them, but we don't typically see the same degree that we do of physical effects as we do with methamphetamines and cocaine. So we know that the regular use of stimulants leads to a 26 times increase in the rate of all-cause mortality. So dying for any reason in people that use stimulants regularly is 26 times higher than the general population. We know people that abuse stimulants have a higher incidence of mental illness, psychosis, paranoia, and delusions. We know that people that abuse stimulants have a very high risk of intracerebral hemorrhage, heart attack, strokes, elevated blood pressure, irregular heartbeats. They also can develop skin disorders, especially with methamphetamine use. There's usually a lot of sores and picking. Tooth decay can happen with that as well, premature osteoporosis. So these are all things that are serious medical issues that result directly from the use of stimulants. There's also, like with opioids, a higher risk of the sexually transmitted disease transmission. And stimulants tend to have a very powerful socioeconomic impact. So people are far more likely to end up incarcerated, homeless, or unemployed when using stimulants. Talk about cocaine. Cocaine, we usually think about vascular problems. So we think about heart attack, stroke, things like that. There's also with cocaine a higher risk of gastrointestinal complications like ulcers or GI tract perforation. It also depends on how you use cocaine, if you snort it, if you smoke it, or if you inject it, and then all of the subsequent risks that go along with those things. This is sort of just an example of what happens in people that use cocaine, but we just talked about those things. Methamphetamines in particular is very powerful as far as the rate of just like overall physical deterioration. People that are using methamphetamines, when they walk in the door, anybody that sees them can tell that something is not right with that person. And they may not know what it is, but they look sick. They have muscle wasting. They're usually very thin. They're usually not acting right. I mean, it's very obvious that people on methamphetamine are using some kind of drug. These are some of the skin lesions we talked about, but you can find them all over the body. And then tooth decay is typically seen for a couple of reasons. One is just lack of hygiene, and the other is methamphetamines decrease the rate of saliva production. And so that mouth dryness can lead to increased dental decay. The last thing we'll talk about are benzodiazepines. And benzodiazepines used to be prescribed all the time. And they used to be prescribed particularly to women. Starting very early in this century, women were thought to be hysterical and thought to be morally weaker than men. And so benzodiazepines were given very frequently for their nerves kind of thing. We don't see it as much anymore, but we still will have people come in that have been prescribed Valium or Xanax multiple times a day for the last 20 years or something like that. There's no indication to use benzodiazepines like that, and they're very strongly addictive. Before I practiced addiction medicine, I worked in internal medicine and pediatrics, and I would never prescribe benzodiazepines for longer than a couple days because almost everybody that takes them seems to become heavily reliant on them. We will have people that will refuse treatment for other substance use disorders because they can't take their benzodiazepines here and truly feel they cannot live without it, that they will not be able to survive without their Valium or their Xanax. And that's not true. We know that benzodiazepines cause physical, psychological dependence and have a very serious withdrawal. It's one of the only substances where withdrawal can potentially be fatal without medical care. So both alcohol and benzodiazepines can be fatal in withdrawal. Other drugs might make you feel terrible or feel like you're going to die, but you won't die from withdrawal of other substances. But you can from alcohol and benzodiazepines. People on benzodiazepines have a much higher incidence of depression and suicide. Benzodiazepines can induce amnesia and can lead to cognitive deficits. So people will go to neurologists thinking that they're developing dementia, and it's not dementia, it's the benzodiazepines that they're taking. Over the age of 65, you have a 80% higher chance of breaking your hip in the next month than you do if you're not taking benzodiazepines. It leads to a lot of falls and injuries, especially in people that are older. And very frequently, people will use benzodiazepines more than it's been prescribed. So the doctor may say, take one twice a day, and invariably people will take them twice a day, but then, I really needed it after I talked to so-and-so, and then they're taking it 3 times a day or 4 times a day. But the guidelines do not recommend for any reason using benzodiazepines over 28 days. And typically it's recommended to only be used for short periods of time in acute, like somebody died and you give a couple tablets to get through the funeral or something like that. But otherwise, benzodiazepines are really not indicated for generalized anxiety disorder or to be taken on a regular basis. Okay.